Hi everyone, Whitney Lowe here from the Academy of Clinical Massage, and today we're going to be looking at another topic of maybe some controversy around some terminology used in the massage profession so frequently. We're going to be talking about what is a soft tissue release. You know, if you're a client, if you're a massage client and you've been told by your practitioner or your therapist that you've got to do something that's going to help release some tissue, it's going to release a ligament or it's going to release fascia or something needs to be released. That's something that you may hear often, and we as practitioners say that kind of stuff a lot. But there's really a lot of sort of misunderstanding and confusion about what that really means. So let's take a look at what is a soft tissue release, what does it mean, and when is it really happening, and when might it not actually be happening. The first thing to note about this is we really don't have much evidence to support any of these ideas. So what we have to do is we have to take information that we do know from physics and physiology and biomechanics and anatomy and take those concepts and then convert them into what we know and can understand about what's happening in the tissues and sort of project what we think may be happening under certain circumstances. So the best we can often do is take those things that we do know and try to extrapolate them into the theories that we have about what's occurring. One thing to remember is that many of these theories may sound good in theoretical frameworks, but they don't really get supported that much by what happens in the research. So we're going to try to look at making sure we can come up with ideas that are supported and that there's good evidence to indicate that this is what's really happening. The other thing that makes this difficult for so many practitioners is many of the people in our field are very much tuned into the experiences that they have in the treatment room when working with clients. And they'll say, yeah, but I feel this. I feel it when I do this thing. I feel this tissue release, and I know this is happening because I can feel it. And we don't want to invalidate that idea. Clearly, there are things that you will be able to feel, and especially the more trained you are as a practitioner, your palpation skills are much more refined. You will feel things that other people don't feel in those tissues. But just because you feel a particular thing, you have to be careful about the definition or the explanation that you assign to what it is that you're feeling and make sure that that still is an accurate representation of what's really going on in the tissues. So let's talk about what are some of those likely mechanisms of a tissue release that we're saying that we're feeling. One of the first places I'm going to start is looking at some of the common terms that you hear about release and what's happening in these tissues, such as adhesions. We're releasing adhesions in these tissues. Now, an adhesion is some type of connective tissue or something that is binding or restricting two adjacent tissues from being able to be mobile in relation to each other. So, maybe some layers of muscle or something like that have become fibrously adhered to each other. And what we do with our manual therapy is supposed to go in some instances, break up these adhesions or scar tissue and encourage some degree of additional mobility between these adjacent tissues. Now, from a clinical standpoint, it seems to work under a lot of circumstances when you take certain types of things where you feel there's fibrous bind or restriction and you can feel something in that tissue that doesn't feel like it belongs there. And maybe there's an old injury in that area where there is a very good reason for some scarring to be present there. You go in and do some type of work like maybe a deep friction massage or some type of tissue work that is supposed to encourage mobility between these adjacent layers. And after that treatment, there is an increase in mobility between those adjacent tissues. There's a good chance that we have enhanced that to some degree. And there is some good evidence that maybe this is occurring because of maybe breaking up or helping to increase the pliability of some of this scar tissue or the adjacent fibrous tissue between these different layers. Now, one of the questions that we always want to ask about this kind of thing is like, how permanent is that? If that just goes away within an hour or two after the session being performed, it's probably not something that got released in terms of scar tissue because it wouldn't be likely that it would bind back up that fast. But a lot of times you can get much more permanent, much more long-lasting results from some of the work that you're doing. And in those instances, there's a good chance that we are doing something like that, especially if there's some kind of former history of binding and restricting tissue like a scar tissue in that area. Another example for something like this that might work is the condition of Tenosnovitis. That's where you develop for adhesions between the tendon and its surrounding synovial sheath, especially in the distal extremities. And some of the work that we do on those tendons and their tendon sheaths may encourage a greater degree of slide and glide between the tendon and that surrounding synovial sheath. So there's a good chance that some of what we're doing there is, you can say, releasing that tendon sheath inside there, or releasing the tendon from its lack of movement between the tendon and its sheath, and encouraging some greater degree of mobility there. So what are the tissues that would likely experience a soft tissue release? The idea really is, if there is a soft tissue release that is occurring, it's got to be something that's happening to a tissue that constricted, shrunk down, or became bound some degree. So mostly we're going to look at those kind of tissues that have some kind of contractile elements to them, unless we're talking about something like scar tissue, which we were referring to a moment ago. So in terms of a soft tissue release, the main thing that we're going to see the most commonly as massage therapists is muscle tissue. When we work on muscle tissue, we seem to get an increased degree of pliability or softness or greater range of motion out there. We say we've released this muscle and increased its degree of elasticity and pliability. There's a good bit of evidence to still support that idea. So that sounds pretty solid there. The other main tissue that has contractile elements is fascial tissue. We now know that there are contractile cells within fascial tissue that may have some role in causing that fascial tissue to maybe shrink down or bind down a little bit in certain areas. What's unclear is how manual therapy influences those contractile cells in fascial tissue, but there is some good indication that there are probably especially more neurological results than there are mechanical results of our pressure in there that might be encouraging some degree of improved pliability or elasticity in that fascial tissue. Now, despite a lot of the narratives that exist for some of the different types of soft tissue work, I do think it's pretty hard for us to target specifically a deep tissue that's in the middle of a group of layers of other tissues. So to say, for example, I'm going to target this particular technique and it's going to encourage fascial elongation in this particular area when there's tissues above that fascial tissue and tissues down below it. It's pretty hard to get selectively targeted pressure in there for some type of effect. But there are so many neurological effects to the things that we do that can be played out in many of these different tissues. And fascial tissue, we now know, is richly innervated. So there's a lot of potential for sensory information being fed back to the central nervous system from these fascial tissues. And that may be what people are really feeling when they feel that what's called often a fascial release in like myofascial applications or myofascial release therapy, that holding that tissue for a few moments and then gently feeling something let go and relax is probably more of a neurological response happening in those tissues than it has to do with the mechanical load that we're pressing on them. Now, we focused on those tissues that are likely to have some degree of release. What about those that aren't? This one kind of bugs me a little bit because I hear this a good bit. So here are tissues that we're not likely to have a release in because they're not contractile elements. So ligament tissue, tendon tissue, these tissues don't release by themselves. Now, we talked about tendons a moment ago in relation to the tendon sheath in a condition like Tenosnovitis. So yeah, you might get some freedom of movement in a tendon in relation to its sheath in a condition like Tenosnovitis, but you're not going to elongate or get a tendon to let go because it doesn't have contractile elements. The same is true in ligament tissue, and I hear this one a lot. People say, I'm going to do this technique that's going to release, let's say, the sacrotuberous ligament. It's going to release this particular ligament in some other area, some sacroiliac ligaments or something like that. Remember, ligaments don't contract, so you can't necessarily release them with manual therapy. Same thing we could say would be true of nerves, bursa, cartilage, or any of those other soft tissues that don't have contractile elements in them. Now, that doesn't mean that massage can't affect them, but what it does indicate is like it's probably not likely that we're causing any kind of release in those particular tissues. Now, one of the other potential exceptions to that is something that may happen in connective tissues, but this is not as likely to happen from our manual therapy as it is from some other things like very prolonged stretching, and that's something called creep. So there is a characteristic of connective tissues, for example, that when they are exposed to long periods of a tensile load, meaning something pulling on them, that those tissues may gradually elongate to some degree, slightly, but a little bit, after those prolonged loads are applied. And we call this creep. So it's probably not likely that we'll see connective tissue creep from something that we would do in a manual therapy session, because the amount of time needed to apply that load is usually at least several minutes of holding something in that position, and then it may gradually come back. So that's not necessarily what we often think of as a release, but it is something to think about in these tissues. Now, why is it important that we think about these things? The main reason is it's really important that we have accurate narratives about what we're doing, because a lot of times this directs some of the research concepts and ideas, but it also has a lot to do with us making determinations about what massage might be beneficial in treating under what circumstances. And the more we know about the physiological effects of what we're doing, the more we can determine, would it be appropriate in this situation? Would it not be appropriate? What's going to be most effective? And as much as possible, as we communicate with our clients and with other healthcare professionals, we want to try to have an accurate representation of what massage therapy does as much as possible. So try to get our narratives aligned with what we know that's really happening in there. And my encouragement is, let's back off on the word release a good bit, because I don't think it's happening as much as we say it is. All right. Thanks for hanging around. If you'd like to learn some more about what we're doing here over at the Academy, hopping on over to our website at academyofclinicalmassage.com, and do be sure to leave a comment below and subscribe to the channel if you want to keep up with what we're doing with other future videos as well. All right. We'll see you in the next one.